Hi, everyone. Assalamu alaikum. Thank you so much for being here. We'll go ahead and get started. It's 5 after 12, and then others can join us as we're talking. So to start, Bismillah ar-Rahman ar-Rahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatan min lisani yafqahu qawli. O my Lord, expand for me my chest, ease for me my task, and untie the knot from my tongue so that they can understand my speech. One of my favorite things to say before public speaking or in general, I feel that it really helps me move forward. So again, welcome, and I appreciate everyone being here. We're excited. This is sort of the first time we're doing something like this where we talk about how to do well and how to survive during residency. This could apply to our medical students, but also our residents. And I do also feel that as early career physicians, mentorship is something that we need continuously to do well in our careers. So we all know that residency is quite transformative. We have worked really hard during medical school, and now it's an exciting time. However, it does come with its own challenges. And so we have wonderful panelists today who are current residents, who will give us a little bit of insight about how it was for them and hopefully some tips and tricks on what to do moving forward. Before I introduce our panelists, I do want to let you guys know a little bit about AMWPA because that's the platform that's presenting this presentation today. So I'm going to go ahead and share my screen. So AMWPA stands for American Muslim Women Physicians Association, and there's a website, amwpa.org, if you want to know more about this organization. The mission has been to improve the condition of women's health, provide a platform for Muslim women in medicine, and raise awareness of issues regarding community welfare. So you can see how this perfectly fits into the mission of AMWPA. Their main focus is preventive healthcare. And so the mission of the mentoring program, which is sort of a baby, it's a new program started in 2021. It offers guidance and education and support to the learners of all stages of their professional journey. So this starts from actually quite early as high school students, pre-medical students, pre-dental college students, medical and dental students, residents, and hopefully in the future, early career physicians. Though this program participants will have the opportunity to receive mentorship and also make meaningful contributions to the communities. So just quickly, some of the programs that have occurred in the past in 2021, meet and greet with some professionals, some in-person meet and greets, and then there's a chapter in several medical schools through which we provide mentorship. There's one at UT Southwestern, UTMB Galveston, Texas A&M, TCOM, UNT, HSC, UT Dallas, UT Austin, UT Houston, UT El Paso. So we've definitely crossed that DFW barrier. And some of the activities that these chapters will do are networking events, participate in health fairs, leadership conferences, some of the workshops, and currently we're doing a workshop right now, shadowing, rotation, internship opportunities. There's also dinner with faculty, Ramadan iftars, Eid get-togethers, a lot of just moral support and building connections. And some of the earlier workshops included, advice for first year of college, preparing for MCAT, some extracurricular guides for pre-med students, the medical school admission application process, just a lot of advice. And so today, my name is Dr. Mehreen Khan. I am a psychiatrist. I'm also an associate program director at John Peter Smith Hospital in downtown Fort Worth. I did my fellowship in consultation liaison psychiatry, and my passion is women's mental health, reproductive psychiatry, and consults in general. And I'm happy to present our panelists, and I'll go by when when they're speaking, I'll talk about a little bit more about them as they're speaking. But they're all residents. Dr. Henna Raza is a resident, a psychiatry resident. Dr. Safiyya Zaidi is a pediatric resident, and Dr. Ahsan Khan is a psychiatry resident as well. I think I'm doing good on time. So I'll go ahead and introduce Dr. Henna Raza. Dr. Henna Raza is a PGY3 psychiatry resident at John Peter Smith Hospital in Fort Worth. She has grown up in the DFW area, attended UT Arlington for her undergrad. She attended Alabama College of Osteopathic Medicine for medical school. She plans to work as a general adult outpatient psychiatrist. While in residency, she has continued to keep up with her hobbies of traveling, reading, and a love for coffee and matcha. So I will stop here and let Dr. Raza speak a little bit about her experience and her advice.
Alrighty, thank you so much, Dr. Mehreen Khan. I know we wanted to have a couple of slides just as a reference point, so I will share my screen. I won't necessarily, I don't plan on just reading off of them, but I do want to make sure that we have something to look at. Are you guys able to see my screen okay?
Yes.
Okay, you guys are able to see that? Okay. So there's a lot of different things, of course, that come with the start of residency. It's very rewarding. You learn a ton. It's great for, education, getting us prepared for the real world. But at the same time, it is really, really exhausting. It can be really draining, not only physically, but also mentally. So I just put a couple of slides together. They're very much reference slides, bare bones. I just want to go through some signs, symptoms, how we can prevent them, but also share some of my own maybe examples of how I experienced burnout and how I work to overcome it, or am working to overcome it as well. Okay. Couple of signs and symptoms. This may seem kind of obvious, but it's really, really hard to, I think, detect on our own and recognize it in ourselves. So a very, very common hallmark symptom of burnout is going to be emotional exhaustion. This will look like chronic fatigue, lack of energy, irritability, dread of work, and emotional depletion. And by chronic fatigue and lack of energy, I'm sure everyone's thinking that's what medical school, that's what residency is all about. Sure. But you will feel fatigued and depleted energy despite having adequate rest or adequate time off, things like that. Things that should recharge you simply won't feel like they are doing so. Simple tasks might feel super draining. I definitely remember hitting that in my first halfway into my first year as an intern. I just felt like I was going really, really slow at finishing notes, chart reviewing, things I was doing okay. Even several months before, just felt super, super draining and really hard to complete for me. And then not wanting to go to work. I think I experienced this more on medicine. It was just very draining. I felt like I barely had time to sleep, eat, do anything besides be, just constantly chart reviewing or holding the pager or checking on patients. So I do remember feeling like that I just wanted a few days off to maybe just truly just sleep. And then feeling emotionally depleted. This can make it hard to kind of connect with patients, connect with other people, engage in activities outside of work, which I also remember turning down a lot of things, a lot of hangouts, just because I was so exhausted and I felt like I just couldn't do anything. Another couple of signs, symptoms are going to be detachment or depersonalization. It can be very easy to get, I feel like, detached, or sometimes you'll hear a lot of people say jaded. That can come as a loss of empathy, reduced compassion, meaning it's really hard for you to connect with patients. Sometimes you find it hard to show sympathy towards them, or feel kind of concerned the way you should or you were before. You might feel kind of this indifference, or overall kind of pessimistic attitude about your work, their patients, others around you. And then also social isolation, which is a very, very big one. I think no matter how many people you have around you, residency can and will feel really lonely at times. I A personal anecdote. I got married just a few weeks before residency started. So not only was I navigating first year of intern year, but I was also navigating first year of marriage, which was very tough. I remember specifically one of my rotations, a 6-week period that I did of nights on the Psychiatric Emergency Center. We worked 5 12-hour shifts. We would get 2 off, and then we'd repeat that for 6 weeks. And I was very, very lucky to get my entire month of Ramadan also during that time. I know some people were like, oh, but you got to eat, all night. You didn't have to worry about, the daytime because you were sleeping all day. Sure. But with that came a lot of loneliness, isolation. I used to eat iftar and suhoor both at the hospital by myself. Sometimes I would not get to eat iftar for like 2-3 hours after, just depending on how busy things were. And my husband was great. He made both iftar and suhoor for me. So he was very, very caring. But I missed out on a lot of family gatherings, a lot of iftars, a lot of time at the masjid. So I remember that was a particularly isolating time for me. So there will be times where it is absolutely lonely and draining. And I wasn't seeing my colleagues either because they were all on days. So it was very, very lonely. Another sign or symptom is going to be a reduced sense of personal accomplishment. This is going to be known as imposter syndrome. Everyone will have this, and I don't know if this fully goes away during residency. You will question your abilities, if you're cut out for medicine. I know I did. I don't know if anyone has not been through that, but if they say they have, and I think they're probably lying. You'll feel a lower motivation. You'll feel, I just went all the way back. You may feel like you're not reading enough, studying enough, or reading up on, new evidence-based treatment methods. It'll get really hard. It'll get really tough for you to want to do any of that after maybe 14, 16-hour days. So do not beat yourself up about that. Procrastination, being inefficient, decreased job satisfaction. We already kind of talked about that, and how we will kind of have this sense of dread going back to work, just because we are so drained. We just feel so maybe incompetent, or just like we're doing things for no reason. We feel like we're not making a meaningful impact. So those are things to look out for. And what can this all lead to? So a couple of things that might be kind of obvious, but always a good reminder. Of course, physical symptoms. You will hear about a lot of GI distress, appetite changes, sleep changes, either insomnia or hypersomnia. I think I was the latter. I felt like I could just sleep all day and still feel super tired when I got up. Cognitive impairments, trouble with concentration, memory, attention, poor judgment. This can lead to making errors. And, for people that, practice and teach others preventative medicine, we tend to neglect ourselves, and we can't make good decisions for other patients if we are not well rested and functioning at our best ability. Behavior changes, things like neglecting yourself, hygiene, nutrition, rest, maybe showing up but not really being present, not really being there. And it can increase stuff like substance use, alcohol use, very, very, very often as well. Strained relationships, I kind of already talked about that, but you might find yourself being more irritable, feeling guilt for not seeing family or friends. I remember I would feel really, really guilty if I said, hey, I just want to take a day off the only one I have after 12 weeks straight. And I just kind of want to rest or do groceries or do something that I've been meaning to do. So I would feel really bad about that. Um, and then a very, very important one, it seems very severe, but it can be very, very easy to get to the point of suicidal ideation. Um, it's very real and more common than you'd think. And we do see this a lot, unfortunately, in our Muslim community, medical community, nationally, globally. And so if you do get to this point where even maybe having these fleeting thoughts, I think this should be a pretty important factor, kind of maybe a red flag for you to at least reach out for help or at least kind of evaluate where you are, what your headspace looks like. Things you can do, again, seems like they're pretty common, easy things to do, but harder to put into place. Prioritizing yourself, sleep when you can. Try to eat well. If you have family, friends, spouses who are willing to help you out with that, that's really helpful. Of course, exercising, mindfulness, hobbies, sometimes it's very hard to put that into practice in your intern year and in the beginning. But I will say I did return to some of my hobbies again halfway through second year. So very proud of myself, but you can get back there. Setting boundaries is going to be important. Saying no. I already kind of mentioned that when you're really tired, you need a break, you've worked 12, 14 days straight, it's okay to say no to commitments, responsibilities, put yourself first, making sure you're doing things outside of work because you need time away from your patients in charge. So on your days off, on vacations, do not chart review, do not check on your patients. They will be okay. And protecting your time off, we already kind of talked about that as well. Take the days you need, take the rest you need when you can. Sometimes it's very hard to actually obtain those days anyways. Having a strong support system, I think, is very, very important. Connecting with your peers, colleagues, co-residents. I was very fortunate. I think the JPS residency is very, very welcoming, very family oriented. And so it was very easy to turn to my co-residents, and maybe Dr. Hassan Khan can, agree with me on that, or kind of talk about that a little bit as well. But we did heavily lean on each other because no one else is going to really know what you're going through except for the people that are going through it with you. So lean on them, lean on family, friends as well. Mentorship, as in reaching out to upper levels, attendings, people who have gone through this. They've done this before you. You don't have to start from scratch. If there are tips, shortcuts for efficiency that are available. So definitely reach out to those people. This is the last slide. I know I'm coming up on time, but ways to take care of yourself, developing coping mechanisms, harder, easier said than done. Identifying stressors, having realistic expectations. I think that's the hardest one. Being able to accept and tell yourself you won't know everything, and that's okay. If you knew everything, you wouldn't be in residency. So the whole point of residency is to learn, apply, and keep learning. That never stops, of course. Reframing things, if you're hitting challenges, think of them as learning opportunities. I'm sure you can learn something out of those. And lastly, something that I think that is very important and you should be able to do, hopefully you feel comfortable, find a contact person at your institution or your program that you do feel comfortable with. Talk to them, let them know about workload management. If you're having a hard time dealing with your patient load or you don't feel like you have the appropriate resources for patient care, talk to them. Our residency, over the last probably several years, 10 years or so, we have brought the cap down for a patient load. So it does happen. You do have to talk to them and let them know if you're not able to get things done or if you're not having the appropriate resources to achieve those expectations. Supportive culture, I already talked about. Access to resources. So by this, I mean access to services for the residents, for well-being, mental health services. Sometimes they do have employee assistant programs where you can get counseling through your work, through your program, things like that. So definitely ask about those if they're available, because you should have something in place like that. And then peer support programs, ask about those as well. But definitely very, very important to speak up for yourself, advocate for yourself and your program, because ultimately you are going to be the person, you're still going to have to do everything that everyone else is doing in terms of learning, taking care of patients, but you want to be able to do it in the most appropriate and efficient capacity. That's all for my presentation. My email is here. I can always provide it again later as well. So I'll go ahead and stop sharing my presentation, and then I will give it back to Dr. Mehreen Khan.
Thank you so much, Dr. Raza. That was wonderful, and thank you for sharing your contact with everyone. If anyone needs to talk to Dr. Raza or has a question, she did kindly provide her contact information. And I did forget to mention, yes, please put your questions in the chat if you have them. I know that sometimes we have a question and then we kind of forget by the end of the presentation. So feel free to put it in the chat and we'll come back to it. All right, so let's introduce our second speaker. Let's see. We have Dr. Safiyya Zaidi. All right. Dr. Zaidi is originally from Katy, Texas. She attended college at University of Houston, where she majored in biomedical sciences. She went to medical school at Dell at UT Austin. She moved to Memphis for pediatrics residency at, I'm going to not be able to say this correctly, but Le Bonheur Children's Hospital. Dr. Zaidi, please let me know how to say this. She's planning to apply for PICU fellowship. So welcome, and we look forward to hearing from you.
Thank you, Dr. Khan. You're not the only one in my interview at UTHSC. I didn't know how to pronounce it either, and so the faculty member that was interviewing, I just made up something. I said Le Bonheur, like it was French or something, and she corrected me that it was Le Bonheur. So it's Le Bonheur. But it's a really good hospital to be at. And so I think I'm just going to be talking a little bit about how intern year was difficult for me and some of the tips that I had looking back that I would try to implement earlier. A large part of why intern year is so difficult is that you're navigating a new system, a new role with increased patient load than you have ever had before, as well as also trying to deal with your perception of how you are doing as a doctor and also others' perception of you and the feedback that you're receiving. So first I'll be talking a little bit about advice on being a good intern and tips on being a good intern. And so overall, your job in the first year of residency is just to be a good intern. That's it. All the knowledge that will come later on will come with time. And so some things that I learned are, one, try to prep your notes beforehand. This is the first time in your career where you will have to do like 7, 8 notes per day. And that is, I think, most specialties. And so what I didn't realize until my second year rotation is it's much easier to be able to get there at a certain time or be able to manage your day or your morning in a specific way to set time aside to prep your physical exam, like write it out or, have your physical exam ready. And then your subjective. And so when it comes time to after rounds, instead of having to start 6, 7 notes from scratch, which can take like up to an hour and a half, while also having to deal with a new admission or like the afternoon stuff for your current patients, it's much easier to just quickly write in a few things with the plan and then just submit it. And you can do it one after the other in like less than 30 minutes. This also helps your mental space in order to like learn more things in the afternoon and focus on things in the afternoon. The second tip that I have is to see all patients before rounds. And with that is actually turn the light on and wake the patient up. The first part is, it is difficult in intern year to be able to do that because of how overwhelmed you are with doing all the chart review and getting short on time and also having to deal with like morning report. But making a priority to see all patients before rounds, because people can always look at charts later or during rounds, but seeing all patients before rounds helps with just being a good intern and how you look towards the team and to your supervisor and to your attending, but also it's a pretty important aspect of care just to actually have an exam in the morning. And also you don't want to be running around patient rooms in the afternoon and the evening like I would have to do and staying late to try to get your exam in for the note. And then one time, there was a time where I was like my first supervising month, that was like my first week of supervising. I was gonna say it's important to turn the light on and wake your patient up. This is less important for pediatrics, but even for pediatrics and especially for adults, you wanna be able to wake them up and make sure that they have a good appropriate neurological exam. You don't want to miss something, an adult, I guess, like a stroke or an altered mental status. And even for a kid, you don't want to miss an altered mental status because you thought the kid was sleeping, you didn't see him properly because the light was off, and they were there for something else. And you're like, oh, I listened to their lungs, they're fine. So that's an important tip that honestly is hard you don't know intuitively until you experience something like that. The third thing is, the third thing is to run all things by your supervisor anytime you are in a non-supervisory role. And it's hard to internalize this intern year. I only knew this because I'm a resident medical student. There was a supervisor who said, this intern runs everything by me as an intern should. You will have time to you can always make your own decisions and think, but it's very important to run things, and much better to run things by your supervisor before you actually do them. And I took that. I kind of anytime I was in, like, that was my way of dealing with things all throughout intern year. The fourth thing is to double check all orders and prescriptions. That is something I also learned at the beginning of intern year. Mistakes do happen, and I always caught myself because I double checked the order and everything. That I was able to like correctly know things that I may have missed earlier. And then the last thing about this category, about just general advice about being intern year, is there is a pressure to learn things and do things that were there's a pressure to learn. And you think about when you're a supervisor, and people will say, read up on this, read up on this. For me, I think the best system is to read up on things at home, through UpToDate or listening to a podcast, but not worrying about the time frame, like not worrying about trying to do something every day, and also not trying to like look at the podcast list and like just picking one. For me, the best thing that I thought worked for me was if I saw something that day, like for example, if I had a patient, I had like that was initially made for upper GI bleed, like doing that after, because when you see that in clinic and then you read up on it after, you kind of internalize it much better, and it's much funner than just trying to like read UpToDate articles or cold listen to podcasts. And all of this that I said helps with confidence and can avoid feeling overwhelmed. The second thing that I want to talk about is choosing a residency program, regardless of which specialty. It is really important. Whenever you're on the interview trail, all the programs will talk about their individual curriculum, what's it like in the city they live in, and how they do things in terms of mentoring. I believe that a lot of the stuff is very similar. The training is very similar and different in all these different programs, especially in pediatrics. And as long as you're an academic institution, you will have the resources and the training that you need for your whole career. So the factors that I would factor in, is the proximity to family. I think that really does help a lot. And I didn't realize much more difficult it is to have to fly in and out like multiple times a year versus just driving. And also the money that you spend on plane tickets is a lot. The co-residents, I think you know what your crowd is, and not just the field, but also know what kind of people that you have an easier time making friends with. And of course, you can't pick your co-residents, but you can get an idea based on the co-residents at the program that are already there. And then for me, I think proximity, and for everyone here, proximity to a masjid is really important. A lot of the programs at academic institutions are in major cities, and a lot of the masjids are, as we all know, are in suburban areas. And however, there's some masjids are in the city, or there's a very close suburb. And so it's to keep in mind of what kind of whether there's a close masjid to you, will make a big difference in intern year and throughout all of residency, inshallah. And then, so the academic institution is important, and people tell you, okay, you know, it is important to be exposed to this and this. But I think the factors that I said weigh a lot more in the end. And then the last thing is, I wanted to say is, as Henna already pointed out, is you will reach a point in your intern year where you will experience burnout. And when I was starting intern year, there was one of the residents on my interview trail who was like, it's not a question of if, but when. Some people will be December, some people will be February, some people will be March, November. You will kind of feel, for me, I felt that I didn't want to go to work every day. Like I was showing up, I was like 20 minutes, 20 minutes late or whatever. And it's a little bit hard, but you do get through it. You do move on to a new rotation. And it's also possible to feel that you made the wrong career choice in choosing medicine. And for me, I remember when I first started, I was like, oh, I cannot deal with all this responsibility. Maybe I should have gone into like a different healthcare field with less responsibility. But that is pretty, and also I felt that, oh, I just feel like I'm just writing notes all day. Like it is a very typical feeling. You're not alone if you feel like that. But give it time, and with the confidence, you will be able to, inshallah, shoulder that responsibility and have a much more enjoyable time in residency.
Thank you so much, Dr. Zaidi, for that wonderful presentation and sharing your advice. Again, I want to ask everyone, if you have questions, please do put them in the chat and I'll come back to them at the end. And I also have some questions for our panelists, so I will be asking those at the end too. Let me share my screen again and introduce our final speaker, Dr. Ahsan Khan. All right, Dr. Ahsan Khan is originally from Houston, Texas. He attended Texas A&M University for undergraduate studies, then Arkansas College of Osteopathic Medicine for medical school. He's currently a PGY3 psychiatry resident at JPS in Fort Worth, John Peter Smith Hospital in Fort Worth. While in school and residency, he has continued to develop interests such as cooking, sports, and hiking. So I look forward to hearing from Dr. Ahsan Khan.
Thank you so much, Dr. Khan. Let me share my screen as well. So we have a lot of JPS psychiatry representation here. Okay. Is that showing up properly?
Yes, it is.
Okay. So how to survive first year of residency. I'm Ahsan Khan. Nice to meet everybody. I think a lot of what can be talked about on this subject has already been touched on by Dr. Raza and Dr. Zaidi, but I have a little bit of a different perspective, both because I'm a guy and also everyone's just a little bit different. So I know there's going to be certain things that maybe worked for me or didn't work for me, and it would be different for somebody else. I think part of the theme of what I was going to talk about is finding what works for you, and that'll be a little bit different. So think of it kind of like when you were searching for just the right resource to help you get through step one, and it's going to be a little bit different for everybody else. Your study materials, strategy, all that kind of stuff. So, all right. So about me, I was raised in Houston. Family is from Pakistan, and my family moved to Qatar in 2010. And so that kind of, is relevant to what we're talking about here in a second. They moved to Qatar in 2010, and then they moved to Pakistan in 2022. So I've been by myself here since 2010. My dad did stay for one more year. Then I went to Texas A&M and ARCOM for medical school. And the reason I mentioned plenty of hobbies, I would say before medical school, I had a wide variety of interests, maybe a well-rounded person. Part of it may have been because I was trying to beef up my resume and look cool, for the applications. But I think some of it was just I had a lot of things I like to do, and I was fortunate for that. But it all comes crashing down, or so you think, when you get into medical school and then residency. So what did my intern year look like? I was living by myself. As I mentioned, my own family was overseas. I was engaged, but my fiance lived in Alabama at that time. She was someone I met in college, and thankfully everything, worked out well. We're married now. So she was living in Alabama, completing her own residency, and my soon-to-be mother-in-law and brother-in-law lived in DFW, but they were a little bit far away. They're in the Euless area. I wasn't super close to them at the time, either physically or, emotionally, because from the very beginning, when we got engaged, my fiance lived somewhere else, I lived somewhere else. So we just didn't have that much time to do, family activities, meet together, all that kind of stuff. Some of my friends from college lived in DFW, and I credit them, like they helped me get through intern year as well as my co-residence. And then I had way less time now to enjoy the various things that I liked to do. So when you have night shifts, so like Dr. Raza mentioned, 12-hour shift at night, and you do that 5 nights in a row, and then you come back for the weekend, you have 2 days where you can either sleep or do stuff. And so most of us just choose to sleep. It's too short of a time to switch your schedule around. Long hours, weekend calls on other rotations when you're working on the weekend and everyone else is doing stuff and you're just in the hospital or something like that. That's the classic residency experience. So that part wasn't anything unique towards me, but it was something that I had to deal with. So Dr. Reza also had talked about isolation and burnout. I'll talk about it as well, but a different perspective. So going into it, on one hand, it's tough. Residency is difficult. I think it's supposed to be. It helps you develop into a stronger physician and maybe builds character, whatever you want to call it. But it is difficult. Some of the difficulty feels pointless at times, and you're like, why am I even doing this? This is just hard for no reason. Some of it is difficult because, you have to learn that way. So there's differences in that, and that just kind of depends on what specialty you go into, what program you go to. You come in, you have to think about what goals do I have for this? I'm in residency, I'm an intern now. I've worked for up at this point 8 years at the very least in college and in medical school. You've been working your butt off. You've already made sacrifices. So in college, doing pre-med stuff, you probably, I know I didn't have nearly as much time to, do all the social things that people in college do, because I was like, well, I got to study. I can't afford to not get a good grade at that test or whatever. So we've all been there. That's one sacrifice. And then once you're in residency, like I mentioned that I had friends in DFW from college. So something I found was I would go stretches of months at a time where these friends would say, "Hey, Essen, come over. We'll celebrate Eid together, or we'll do this or that. Let's go to Tarawih, whatever." And I would say, "I can't. I have to be in the hospital." And so that is a sacrifice, is for whatever social circle you may have had that is not in medicine. They get it, but they don't really get it. You tell them, "Oh, I'm in residency," and everyone's first reaction is like, "Oh, residency, that's crazy, that's so difficult." And so they can say that, but they don't quite understand what that difficulty entails. And so this is some of it. You might find yourself, you're going to feel guilty and bad that you can't do as much of the things that you're being invited to or that you would like to do. Um, but the other people as well they might start to feel resentment, like, oh, Essen never comes to anything, he doesn't care. So that's a challenge. And then the reason I wrote "but limits" there is, so residency is sacrifice. It involves sacrifice, but there's limits to that. You don't need to become a martyr, shaheed. You're not in residency to suffer. You're there for a purpose, to learn, to grow, become a physician, a better physician at this point. And so you have to understand there's difficulties that go along with that, and then there's difficulties that are just tough for no reason. And maybe, we've all heard stories about people experiencing different kinds of abuse or blackmailing or anything like that at different residency programs around the country. We've had residents who feel so bullied and burnt out and whatnot that they end up committing suicide. So you have to understand that there's limits to what you're supposed to be experiencing and suffering. You shouldn't just be suffering. That's not what it's about. So by understanding that part, which is tricky, it's not something that you can just know off the top of your head. I think Dr. Raza did a great presentation discussing how to identify those things. That's when you say, okay, this is okay, this is not okay. And then when you get to the points that are not okay, that's when you need to start looking.
This is
حسين
Is that a question?
No, I don't think it was a question.
Oh, okay. Just unmuted. Okay. I have it on the presentation mode, so I saw someone did post something in the chat. I hadn't looked at it yet. What about relationship with faculty? Yes, absolutely. I'll talk about that in a second. So strategies, now this is the specific stuff, strategies to avoid the isolation that you find. So I think it's wonderful that this organization, AMWPA, has all these different branches. So for those of you in the audience who go to one of these medical schools or residency programs in these areas, definitely getting involved with a community like that, or if that's not your thing, anything else, there's a Dallas Muslim running club that I have not joined yet, but I've been thinking about joining, and I'll get to it eventually. There's going to be your co-residents, all the residency people that you work with, faculty members, absolutely. I have been fortunate and blessed to have some amazing faculty members that, while they are, my boss kind of in a sense. I also see them as mentors. And so I have at times reached out to faculty members and been like, I need help with something. And they've been great. Not every faculty member, I'll just be realistic, not every faculty member at every program is going to be like that. That's someone you can go to. But I would wager that most programs have someone that you will mesh well with in the faculty and be able to talk to and bond with and that kind of thing. So finding your community is very important. I would say make that one of your main priorities when you start residency is finding your group of people. It worked out for me because I'm in DFW. I have friends here. Now my in-laws are here. But for some people who are moving across the country to a place that they've never lived in before, they matched in a program that maybe wasn't their top choice and they don't know anyone there, or maybe it was a wonderful program, they wanted to go there and they just understood I'm not going to have any community there. Definitely, first thing you should start working on is finding some group that you can be a part of over there. When tired, still do stuff. That's a balance. If you're really just exhausted, you came off nights or whatever, you need to sleep, then sleep. You don't want to be sleep deprived. But there are going to be days where, especially later on in residency, in my experience, where it's not necessarily that your hours are crazy at this point, you're just tired, mentally exhausted. I guess that's the burnout part. And so, instead of going to eat out, oh, I'm lazy, I'm tired, I don't want to cook, I'm going to go just get some fast food or something. That's when you need to push yourself to say, I'm going to do something. I'm going to cook myself a meal, or I'm going to go for the run, or I'm going to go hang out with those friends that invited me, even though I feel a little bit too, I don't feel like doing it. It helps a lot. It helps a lot with recharging and feeling satisfied with your life, because especially in psychiatry, we find that one aspect of mental health and leads to depression and whatnot is social isolation. And it can be a chicken or egg situation. Maybe the social isolation started and then you become depressed afterwards. Maybe you're depressed and then you start isolating yourself. Either way, one of the keys to that is to prevent the isolation. And so, doing things even when you don't necessarily feel like it, within reason, I would say, is very important. So just keep that in the back of your mind. And then strategies to avoid burnout. Dr. Reza already talked about some great stuff. I'll just mention, so one of the things I said earlier, I had all these different hobbies and interests I like to do, spread myself very thin on all that stuff. it doesn't work. You can't do that. So in residency, I had to decide on like one or two things, maybe on particularly easy rotations, I could add a third. So for example, I like to cook. So I cook myself food and I eat something, and that helps with the mental health. Like, okay, I did something, I accomplished a task. I ate what should hopefully be a tasty meal or whatever. There's a sense of satisfaction there that helps. So whether it's cooking for you or anything else, just find something that you like to do. Doesn't have to be anything expensive or crazy or whatever, just something that you can do on a day-to-day basis. Keep yourself grounded, you know, maintain some aspect of your identity and your personality outside of work. That goes hand in hand with the paying attention to your mental health thing. I won't go too much into that because Dr. Raza talked about much more specifically, symptoms and whatnot. And then utilizing resources provided at your program, that will just depend on the program and how comfortable you are with them and what they offer. But I think most places, especially there's some ACGME guidelines that say that they should provide some sort of mentorship or help available if needed, if things are not going well, if you're struggling. And so you might be tempted to say, oh, I don't want to utilize those resources because then people will find out that I'm struggling and I don't want anyone to know. Or, it might come back to bite me because now they'll know that I'm struggling with this. And so they won't keep me here or they'll punish me in some regard. Don't worry about any of that. Once you're accepted into a residency program, the goal for both you and for your program is to get you through, make you a attending physician, and as best as of one as you can be. They should be there to help you accomplish that task. And so if you're struggling, that's normal. All of us struggle. Uh, you're expected to not know everything when you're an intern or just throughout residency. So if you don't know anything, or if you're struggling, if you can't get your documentation done on time, whatever the problem is, reach out for help. Ask people who have been there or people who are trained to help you manage that situation. And in the end, I don't think you will regret it. And I think there's another question. Exercise is important to decrease stress. Yes, I completely agree. Yeah, not I just agree with that. Definitely, if even if it's a walk, a couple times a week, do something. Don't become a total couch potato. I was guilty of that at some point, especially when I was on the nights. But I think it's important to maintain some physical fitness as well. And that is it. Thank you. That's my email address as well. If anyone has any more specific questions or just, needs any help with anything, I'd be happy to. Thank you very much.
All right, thank you so much, Dr. Khan. Those were wonderful tips and a discussion on residency. I want to thank all of my panelists. It was a pleasure listening to them. I do want to talk about, when listening to everybody, I came across this word a lot. I heard this word a lot, isolation. And it came from all three of my panelists, and I can't agree more. I think it's residency is a very isolating experience. And you have to remember that when you are going through residency, something really, really busy, something really important, and everyone else seems to be enjoying their life, going to eat parties and doing Ramadan together and going to iftars together, even suhoor. There's suhoor parties. I've never attended one, but I've heard they're really fun. And doing all these fun things, getting married, having babies. You might be having babies and getting married, but that's it. You get married and come back right to work. So it can be very, very, very isolating. So so these pearls that everyone gave you are so important. And I'm actually very proud of the attendees that we have today. And the reason is that you are very proactive in your health. So you see this poster of how to survive, and you're like, yes, let me go and figure this out before I have to do anything. And that's important because you have to be proactive. You have to be preventative. Preventative medicine is proven to be the best approach. And so being a proactive going into residency, asking questions, figuring out how to survive it's going to serve you really well. Having said that, I do want to, and everyone knows this, but I think a reminder is always good. Failure is imminent. It's going to happen. If not today, tomorrow, next week, next month, next year. We cannot run away from failures. We cannot become anxious that they're coming. We just have to do our best, and if it does happen, we will figure out a way, if not alone, then as a community to figure it out. So a lot of times in med school and residency, things don't go the way you planned. You can fail a test, you don't match, fall behind. You have to try something over and over and over again. But that's your plan, right? So that's your plan. And then there's another plan, the greater plan, the one that God has created. And you try your best towards what your goal is and your plan is, and then Allah will guide you towards something better. So if there is anyone in here who has had failures, or they can't overcome from those failures, or are too afraid of failures, reach out. If you don't feel comfortable reaching out to family or friends, there's mentors here, and they were gracious enough to leave their email addresses. Reach out to someone that you want to talk to and just ask, how can I overcome this failure? Mental health is very important. We are in the field of mental health, so we see this a lot, and we don't want to lose anyone. We don't want to lose med students. I don't want them to drop out. I don't want them to do anything to themselves. I don't want to lose residents. A lot of people switch fields. So, there's things that can be done. So we want I always tell this to my residents, I want them to be leaders. I'm going to do everything in my power to make them the next leader, so they can continue this cycle of creating really strong physicians with a lot of empathy. Having said that, I want to open up the questions. If you don't want to write them in the chat, does anyone have any questions for any of the panelists or me that they want to talk about? Okay, there's a comment, there should be a positive attitude that you're going to be training to be a doc to help others. Yeah, and the attitude, the positivity sometimes is lost, but it can come back. I mean, everybody wants to be a strong and positive person when they come into residency, but like most of our panelists said, it can become really, really hard. When you're working a lot, when you're isolating, when you're it's supposed to be very, very difficult. And so the support that we see coming up now, there are things available for if you don't feel positive anymore. So if we don't have any question, I want to ask, as we are coming up only 2 minutes on time, for each of you, Dr. Khan, Dr. Raza, and Dr. Zaidi, if there was one thing you would want your learners or to kind of focus on, like one thing that they could remember from this meeting, what would that be?
I'll just quickly start because I'm already unmuted. I would say when you're in the throes of residency in intern year and you start to think, I can't do this, it's too hard, whatever, you are most likely imagining how difficult it is right now, and that is going to last forever. And that's what you're thinking, that I can't do this. But residency does get easier as you learn and know what you're doing better, and just figure out how to manage the stress and manage everything else. It gets easier. Then you'll finish residency one day. And so that overwhelming feeling of I can't do this, I'm not cut out for it, whatever, just understand that it's temporary. It'll get better, inshallah.
Absolutely.
I guess I can go next. I think kind of the theme here was, isolation is a big thing. So I think that a lot of what I have done or to overcome or have, done to feel like a person again, I think comes from a lot of the people around me. So, of course, family and friends that you have that are understanding and are there for you to support you through everything. But also, I do have to give my colleagues and my co-residents a lot of credit because we have been through everything and more together, and we have only gotten closer. And so if you don't have that community, like Dr. Khan said earlier, Dr. Ahsan Khan, you may not always find that in residencies, but having a few good people that you can always go to and not feel bad or guilty that you aren't seeing them every day, I think that can really, really help you keep going, feel like a human being, and keep you from hopefully getting too burned out.
Yeah, I think one thing to remember is whenever you're going through your hard rotations and residency, and especially at the first half of intern year, there will come a time where you will enjoy medicine again if you are feeling. It will come, inshallah. Just give it time. And there are months in residency that are extremely easy, with like 20 to 25 hour work week. So it's not all that bad.
Wonderful. Well, and on I know someone wrote that positive. Yeah. So the topic was to survive, and so when you only survive when there's things get rough, right? Otherwise, you're thriving. So I think that's why we focused more on the mental health aspect and things that could be wrong and how to overcome it. But positive, I mean, I can start. I got great friends, my co-residents I'm still in touch with. We still meet, got amazing friends. I learned a lot through residency. I felt very, very confident as a practicing physician. Nothing is hard anymore. Nothing is hard anymore after getting through that residency. And I feel like overwhelming feelings when you're able to help somebody now. So we can help not only our patients but our communities too. So those are amazing, very fulfilling feelings that we can have. What if someone has taken a gap year because of mental health issues and got taken care of? If there are any problems getting residency, I can take that one. Being associate program director right now, it really, gap year because of mental health issues, especially in psychiatry. And I'll ask Dr. Zaidi for pediatrics, but in psychiatry, anything mental health related, we completely understand. And so as long as, there are other applications, looks good and they fit the program mission, I don't think that's a big issue. Any other thoughts?
And I'm assuming this question is like gap year between medical school and residency, or even in residency. I'm gonna be honest, I do not, as someone who's on the faculty and administration side, maybe might know a little bit more about this. I mean, I know that if someone does have life events, that's very common in residency, and during my interviews, a lot of the program directors would encourage residents to share if something was very significantly impacting their ability to work and they needed to take some time off.
Yeah, typically when it's a gap is due to a health reason, it's never taken against the applicant. So sounds good. All right, we're over time. I truly appreciate all the panelists that are here and took time out of a weekend. They're already very, very busy, and they took this precious time on a weekend to talk. So I really appreciate everybody. I hope everyone has the rest of the weekend a really pleasant and they get to spend time with their family and friends. All right, take care, everyone.
Thank you.